folks, and welcome to Way for Health India podcast, Heart Matters. My name is Amit Gupta, and I am the lead digital marketer at Way India. And along with me, I have Dr. Raman Chawla, who is one of the renowned and leading cardiologists based out of Jalandhar, Punjab. Today, we will be discussing about chronic heart failure, what it actually is, how modern treatments can help people living with heart failure, and why patients can still be at a risk despite getting treatments. And last but the least, why novel interventions are necessary. So, just as per stats, India has become one of the largest heart failure populations in the world. Indian patients are developing heart disease almost a decade earlier than their Western counterparts. So, before we dive deeper, it's important to understand what heart failure really is. So, Dr. Raman, it will be great if you can just educate or tell our audience what heart failure really is.
Hi, everybody. Thanks, Doctor. Thanks, Amit, for inviting me here for the podcast. See, basically, function of the heart is to pump the blood for the requirement of the body. So it supplies oxygenated blood to whole of the body. That's the function of the blood, heart. It has to pump out. Heart failure is when it is unable to function in its own normal way, so that it's unable to pump the blood for the requirement of the body. So heart failure is inability to pump sufficient oxygenated blood for the requirement of the heart. That is called as heart failure. Now, if
Thank.
you ask me, yeah, please carry on.
Just one thought I had. So, if we talk about only heart pumping, is there something else? So, it means there is a variation in the blood pressure because of which there is a heart failure being caused because the pumping is not working efficiently.
So pumping is not efficient. See, normal power of the heart indirectly means when heart contracts, whatever amount of blood is lying in the heart, at least 60% of blood should come out of the heart for utilization by the body. Now, if heart pumping is less than 60%, so blood stays in the heart percentage wise much more. So it's difficult. Heart is unable to pump out blood more is equal to 60%, and then it pumps less than that. So the rest of the blood stays in heart itself, which is pumped back to lungs. So inability to pump sufficient blood for the requirement of the body, which should be 60% of the at least blood, whatever is in the heart, is called heart failure.
Okay, sir. So, apart from this blood pumping, is there any other causes? Maybe like, for example, lifestyle issues and all.
See, that first, before we talk about what could cause heart failure, it is important to understand how heart failure manifests in the patient. Basically, it presents in the form of difficulty in breathing. Patient feels that he was able to go upstairs, two flight of stairs comfortably before. Now he's finding it difficult to go up because of shortness of breath. It starts with that. After that, it comes to a swelling in his lower limbs. There's a swollen ankles, which basically means there's a actually retention of the fluid in the body and heart is unable to pump in the forward direction, which leads to fatigue, which leads to tiredness, loss of appetite, and it is indirectly also manifested in the form of increased heart rate. Patient also start sometimes feel dizziness and lightheadedness. So these are the manifestations of heart failure. So because sufficient blood is not going to body organs, that is the manifestations. Now you asked me that what is the reason why people do get heart failure? This is what you are trying to ask me indirectly,
Yeah.
right? Now heart failure has multifaceted reasons. Generally, there's a combination of multiple factors. A majority of them have uncontrolled blood pressure. Blood pressure is one disease which is called as silent killer. Usually person doesn't take care of his blood pressure control. He says that I do not have symptom at this time, so I don't need blood pressure control. So one reason for heart failure is uncontrolled blood pressure, which is combined along with uncontrolled diabetes mellitus, smoking, poor dietary habits, lifestyle is bad, patient does not do exercise, high cholesterol, sedentary life, this all together ultimately leads to heart failure because heart is a muscle which needs to have its regular blood supply also. And these indirectly, in addition, also causes blockade in the vessels which supply blood to the heart. So this is multifactorial. There's no one reason for heart failure.
Uh, so moving ahead, sir. So we came to know about heart failure, what actually it is, and how things add up to causing it. But I just wanted to know: are there any stats about some kind of challenges which heart failure patients really face in real world? It can be something also, sir, like maybe there are 100 people who are getting heart problems, but how many
Mhm.
of them actually get heart failure issues is something which came into my mind also. Apart from this.
See, there are two ways of looking into it. One is
Mhm.
how many people of hypertension, diabetes, smoking finally land up into heart failure, either
Mhm.
because of the direct effect of these factors or because of the indirect after the blockade of the vessels which supply blood to the heart. This is one question, one part of it. Now, heart failure incidence has tremendously increased. Reason being that these factors combined together does not supply oxygen to heart muscle itself. So possibility of heart failure at least is 20% in its lifetime if person does not control these factors. So this is heart failure incident. Now coming to once patient has a heart failure, what is his prognosis in the form of stats if I talk about? If person is admitted with heart failure symptom once, there are at least 70% chances that he is going to get readmission within 1 year. So it means once admission itself indirectly means bad prognostic sign that person is going to get readmitted within 1 year, chances are at least 70%. Not only that, there is risk of death is 6 times as compared to person who has been not admitted because of heart failure. So once his mortality increases, readmission increases, and percentage of people getting heart failure is going to increase because of these factors, which has actually increased uncontrolled diabetes, smoking, hypertension, lifestyle.
Yes, sir. So I got to know more about heart failure right now. So one thing also came, what are the treatments, for heart failure right now? If you can just explain a little bit in brief about the
See,
treatments.
treatment are basically divided into medicines and non-medical part. I am the person who tries to convince people for the non-medical part equally as compared to medical part. I'll come to medical part afterwards. As far as lifestyle changes, that is non-medical part, which takes care of heart failure, most important are decreased intake of salt. Person has to restrict his salt intake not more than 2 to 3 grams a day. Number 1. Number 2, he has to see his fluid intake is less. How can we manage that? Patient has to weigh at least daily or once in a week to see there is no change or increase in his weight, which indirectly will imply that there is going to be fluid retention and he might need admission because of heart failure. This is as important as controlling his blood sugar strictly, stopping smoking completely. This is all or none. You cannot say I'm smoking less now. No, the problem is you have to quit it suddenly. You have to quit it completely. You cannot smoke. And once person is heavyweight, just imagine heart function is same in person who is thin and heavyweight. People who are obese, the requirement of the heart flow is much more. If they can decrease their weight by at least 5 to 7 kgs, then heart failure symptom will decrease. So salt intake, control of diabetes, control of hypertension, weight loss, stopping smoking. This is one aspect. No, we do have medicines. Medicine will take care of symptoms of heart failure. So, what the patient is finding is difficulty in breathing and dizziness, or feeling his own heartbeat in the form of palpitation, or he is unable to lie flat, he has to sit down at night. These can be taken care of with medicine. This is basically called as guideline directed medical therapy. What does it mean is that we have various guidelines to control heart failure with medicines, and these all medicines must be basically guided by those specific guidelines. They have to be taken in specific doses at specific time, and number of drugs are there. We do have a lot of advances in medical part also.
Yes, sir. So we also came to know that there has been significant advances in medical treatment, but still many patients with heart failure continue to deteriorate. What is that actually, doctor?
First of all, you have to understand this heart failure is not a transient condition. What we are talking about is a chronic condition. It means once person gets heart failure because of poor ejection fraction or poor power of the heart, it will stay lifelong. This is a chronic heart failure. This is not like infection you got today, you take antibiotics, infection is gone. It's not like that. It's a continuing progress, downhill course is there. So muscle are getting damaged as gradually. So this is a progressive condition. That is why even a person's symptoms are controlled with medicine, he still is at high risk of recurrent admission. That is called as heart failure, which is called decompensated. So compensated heart failure means power of heart is less, symptoms are reasonably controlled with medicine. Any factor precipitates decompensations, and every decompensation adds to increased mortality. So number of times you are admitted in the hospital, even if you improve after that admission, chances of mortality, readmission increasing proportionately. So this is chronic condition. This gives away in between. That is why you have to take care of lifestyle, salt intake. There should not be undue physical or psychological stress, either in the form of stopping medicines or some infection happening over it, or you did undue exercise, you had heavy meal. They all will precipitate heart failure again in a patient who's already compensated.
That's insightful, doctor. So, when you were talking, one thing just came to my mind, and I was listening to you about the symptoms. So, the next question from my side is that even if the symptoms have stabilized or no longer evident, so is there a realization that chronic stable heart failure is misleading because your symptoms have stabilized right now?
Yeah, very good. I mean, this is what I want to convey message. Even if a person is stabilized with the medicine, and any bad thing happening over and above it will put the patient again into failure. So what are those factors which make patient stable already there becoming patient unstable? Most important factor which I feel is patient feels that he is becoming better and he stops the medicines. So stopping
Mhm.
medicine the worst, because this is already
Mhm.
these patients sitting on the edge. Like if you push them slightly, they will just fall down, and every fall it's not possible to pick up them again. So we have to stick to medicines and lifestyle modification to prevent decomposition recurrent.
So one more term, which actually medically many people or many doctors use, is about residual risk. I have a very little idea on it, but if you can just elaborate what residual risk is all about.
Residual risk basically means risk which is hidden while person is not aware of the fact. As I told you, suppose symptoms are there, heart failure, you are taking
Mhm.
medicines, he feels I am controlled, now risk is over. No. There's a hidden risk of sudden death. Number one,
Mhm.
hidden risk of changes in rhythm of the heart. Heartbeat increases so fast or it decreases. So that leads to sudden cardiac death is one risk hidden. Second hidden risk is of recurrent admissions. So much so, one in seven patient remain at risk of sudden death or recurrent admission in coming 1.5 years. Life expectancy is less. It has been documented 50% of patients once diagnosed with congestive cardiac failure might lose life in coming 5 years. Means at the end of 5 years, we only have remaining 50% of patients with heart failure because of hidden risk. We have lost them. This is very bad statement. It's a very bad thing to. Somebody has to feel that we have to prevent heart failure. Once heart failure has occurred, you cannot become normal. You will remain in the hidden risk, which is sudden cardiac. That's the recurrent admissions.
Sir, you talked about non-medical and medical ways of, managing heart failure, and so we have seen increasing instances where people, have certain cardiac arrest or certain kind of heart problems. So it all boils down to lifestyle changes, and you touched upon it. But if you can just elaborate on, that medicines are foundational, but lifestyle changes can make a significant difference. So before we close, if you can just tell us, what a person needs to take care upon, so that if he is healthy right now, and he doesn't get these kind of issues in future.
Yes, Amit. Person get pseudo satisfaction that I'm absolutely all right with medicines. So they stop taking care of their lifestyle. And I feel
Mhm.
other way around. You might come out of medicines also, provided you take care of lifestyle. Let's see what are lifestyle changes. I mean, I always feel in my life that people know all the things. Everybody knows you need to exercise, you need to quit smoking. Knowledge is, Amit, not knowing about the things. Knowledge is applying what you know.
Mhm.
So, what I'm going to tell you, I'm going to give you information. So, there's a difference between information, knowing, and the knowledge. So, I'm here to give you information, and you must know that. But that doesn't changes your knowledge. You have to apply what I say. This is what is
Mhm.
there. Let's numberize what I'm trying to say. One must quit smoking. This is cold turkey. You know what is cold turkey? Cold turkey is you cannot decide I'll quit smoking on this particular day. Quit smoking gradually. No, cold turkey is just stop today. That's it. That is cold turkey. You have to take the medicine as regularly as prescribed. You have to follow with your doctor. You have to weigh yourself daily so that you must know that my weight is increasing. It means something else is going to happen to me, and I must consult my doctor. My weight is increasing in spite of all precautions. You have to track your fluid intake daily. What I suggest my patient is they should make a chart where they shall till today since morning till night what amount of liquid they have taken. Liquid are two types. One is direct liquid, but you're taking as a water. Second is indirect, milk, tea, whatever vegetables you are taking. They are prepared in liquids. So you must take care of your intake and output. You must see that your output is adequate. You must measure that so that you are passing adequate amount of urine. You must avoid, I don't say limit alcohol. Limit alcohol basically means again, you're giving it some flexibility that you can take alcohol. No, you must avoid, you must stop alcohol. Avoid caffeine as much as possible. Caffeine increases heart rate, increases oxygen demand, increases blood pressure, that causes patient into heart failure again. So we must follow a healthy heart diet. Healthy heart diet is what? Everybody knows. We must avoid the fried things. We must avoid extra salt. We must not take anything which is high in cholesterol, high in sugar. And I always feel sorry that people don't do it. They just know it. That's it. So be physically active as much as possible. Newton law says, first law, whatever stays in motion stays in motion. Whatever
Mhm.
stays stagnant. So
Stand.
let's try to go on moving. Moving doesn't mean I'm trying to say you go for the gym. Moving means whatever you do in daily activities since morning till evening. We can record this in standing also, isn't it? We can do whatever
Yeah.
work can be done in the moving position also. So it means make your habit of moving. Don't do use left. That is not purpose when you started having stair there, this lift, escalator. They're not for people who are walk. They are people who cannot walk. Now see how habit is changing. So what I'm trying to say is keep your habit of movement in daily activities from morning to evening, not as specific going to gym. So that will definitely help. So quit smoking, control diabetes, take care of your diet, take less of salt, stop alcohol, do as much exercise as body allows you, weigh yourself daily, don't stop the medicines. Let's see who agrees to it, who does it actually.
Mhm. No, I believe, sir, all the insights that you have provided will be, very crucial for people who are actually watching this podcast. And just to close, sir, thank you very much for taking your time today and for sharing your invaluable insights on heart failure. So your expertise has actually truly shed lights on this critical topic, which many people are not talking about. And to our audience, we hope that this discussion has been informative. Please remember that this information shared with us today by our esteemed healthcare professional is meant to raise awareness. It is not a substitute for professional medical advice. If you know someone, or you yourself, or in someone in your family is experiencing these symptoms, please get it diagnosed. And it is better to reach out to your healthcare professional for better consultation. And always follow the guidance of your doctor and seek their advice for any health concerns. And as doctor said, please take your medicines on time. And finally, a big thank you, Dr. Raman. And to stay updated on more such discussions and health related content, be sure to follow Bayo for Health India, Facebook, Instagram, and YouTube. Thank you for tuning in, and we'll see you next time.